Jacksonville Beach Community Analysis by Sean Hill. Jacksonville Beach was settled by the French in 1562. The ownership of this area was in constant flux between the English, French, and Spanish. Then in 1821, the Spanish ceded this area to the United States. This fishing community grew with steamboat workers and travelers and railwaymen bringing trade and travelers to the coast. Even then, tourism was Jacksonville's main appeal. In 1886, the Grand Hotel, Murray Hall, was constructed, and Jacksonville Beach's destiny as a tourist destination was solidified. However, the name Jacksonville Beach was not coined until 1907. As a tourist town, Jacksonville Beach is kept very clean. The beaches and roads are kept virtually litter-free. Housing is also very plentiful, ranging from lower income options to expensive beachfront properties. The beachfront contains many hotels for tourists and locals as well. Lower income families benefit from government assistance through Section 8 and public assisted housing. Public transportation is plentiful, with the taxi system and the bus system running very well and being both very dependable. The taxis are very affordable, and the bus system is particularly good and reliable. However, the buses are not wheelchair accessed, and this can present problems for people with disabilities. Jacksonville Beach boasts of a very big tourist industry. As such, the beach, city parks are kept in immaculate condition. The beach is combed at least once a day, and the city parks are clean, well-kept, and affordable. Sports such as football, golf, basketball can be found in the city parks, and volleyball usually along the beach. Structurally, the inhabitants and locals feel that a lot of money is spent in the upkeep of these things, which is fine because it attracts business to the community. However, there is some thought that some of this money could go to providing health care to the lower income families and the homeless. This community suffers from several population-based disparities. As the population grows exponentially, it is growing more racially diverse at a much slower rate. Currently, Caucasians garner over 90% of the total population. This racial disparity can lead to further marginalization of ethnic groups considered non-white. Also, the population is slowly aging as well, as the number of people over 60 has grown to 20% of the total population. 12.5% of the families are at or below poverty level. This means that non-modifiable risk factors such as age and race with the aging population, and poor education choices brought on by poverty with the families at or below poverty level contribute to this community's need for more healthcare services. Jacksonville Beach is part of Duval County. Duval County's leading cause of death is cancer, with rates of incidence exceeding the Florida average. This may be due to overexposure to ultraviolet rays from the sun that can damage the skin and eyes. In both cases, cancer may result from repeated exposures. Smoking, a known contributory factor to certain cancers, is very prevalent in Duval County as well. In fact, its prevalence is 18% greater than the rest of the nation. Another population-based concern is the presence of communicable diseases. The rate of incidence of chlamydia, tuberculosis, and gonorrhea in Duval County far surpasses the Florida average, and the number of cases of chlamydia alone is 32% greater than the national average. This is especially concerning for high school age children. 30% of all high school age children reported to being sexually active, thus putting this population at particular risk. Access, affordability, and acceptability for healthcare is good if the patient is insured. Emergent care, primary care, assisted living facilities, and most specialties are represented within the community. Thus, insurance is the determining factor for healthcare seeking, healthcare receiving, and outcomes. Insurances are accepted at most all facilities. However, Avante is the only skilled nursing facility within the community. This becomes an issue as Avante does not accept certain insurances. Thus, the need for another skilled nursing facility is present. Jacksonville Beach is divided into those who have insurances and those who are underinsured or with no insurance at all. Those without insurance are less likely to seek medical help, thus putting them at greater morbidity and mortality risks. Baptist Hospital and other faith-based missions defer costs or provide care through charitable contributions. The Sulzbacher Clinic provides dental and medical care to the un- or underinsured. However, their resources are not enough to adequately meet the needs of this growing demographic. Jacksonville City provides waste removal and water services, thus freeing up monetary allocations for this beach community to comb the sands of Jacksonville Beach. Since the community thrives on tourism, safety is paramount. To this end, the city government has taken steps to ensure the peace. The city provides the disaster plan via internet access and posted signs along the roadways. The fire department has added another truck to their fleet that alternates between the two firehouses. The police force hired 3 more officers to better patrol the community. These measures have worked somewhat, as violent crime rates are down, despite a rise in non-emergent calls to both the fire department and police. However, locals are concerned with drug-related crime. Drug-related arrests nearly doubled in the past year, and related crimes such as burglary, larceny, and motor vehicle theft are on the rise. Access to health care. I chose this particular problem because it affects everyone. With the signing of the Affordable Health Care Act into law, healthcare disparities were thought to be alleviated. However, issues with access, affordability, and accessibility exist for the or underinsured. Accessibility is hindered in part due to Florida not expanding its Medicaid program. Hence, at-risk people in the population of Jacksonville Beach are left without insurance. Also, the problem of underutilization of systems and services already in place is a particular problem. For example, somebody who has never had insurance before may not know that preventive services such as colonoscopies or flu shots would be free or at little cost to the consumer. Cancer. I chose this problem because it is the #1 killer in the state of Florida, particularly high incident rate in Duval County as well. Keep this in mind. With a reported 37.7% of all white adults in the state of Florida reporting having had a sunburn in the past year, this is a particular issue. Also, cigarette smoking is rampant in Jacksonville Beach. The window survey showed that there was a huge number of people smoking along the side of the street. The issue of drug abuse was chosen because during the window survey, it was very prevalent at that time in that neighborhood that there was definitely a drug problem here. Jacksonville Beach has a high prevalence of drug abuse. Drug addiction promotes poor life choices, including poor adherence to safe sex practices such as monogamy and using condoms. And those suffering from drug abuse are less likely to seek treatment and therefore usually in poorer health, which leads to greater length of hospital stay and greater cost. Also, this issue affects Jacksonville Beach disproportionately along economic and racial lines. There is still much work to be done here. Lack of skilled nursing facilities presents a particular issue for Jacksonville Beach. Anytime there is a dearth of a service, there is a problem because the community is not being serviced properly. Should a patient have to travel outside the city limits in order to go to a skilled nursing facility, there is the possibility that their family members and friends would not be able to come and visit them. This is problematic, especially for the elderly, as this could adversely affect the patient's emotional well-being and thusly their ability to rehabilitate. Primary and secondary intervention to stem the growth of STDs in at-risk people. At particular risk in Jacksonville Beach are persons of high school age and those over 50. Lax attitude towards sex in both groups must be addressed. Those over 50 view condoms as for birth control only, and teenagers maintain a developmentally pervasive attitude of indestructibility. Education and testing for both groups is vital to stem the rise of STDs. No physical fitness areas or organized team sports for disabled persons. Inactivity increases the risk of negative physical and emotional effects while promoting the helpless stereotype. Providing a safe environment for physical activity for persons who are disabled will decrease the risk of heart disease, obesity, cancer, and loss of mobility and flexibility while promoting self-esteem. Reference pages included. Thank you very much for listening to this presentation.